Overflows.
Ideal frequency of sex in a relationship. Insight into life, love, and light. The purpose of these insights is to respond, answer to those unasked questions which each one of you has deep within, but somehow or the other do not have courage to ask. So, the purpose is to respond to those asked and unasked questions as insights into life, love, and light. In the context of a fight, the excitement of being at odds with your partner can roll into sexual excitement after the fight. This heightens the total arousal experienced. This is like carrying momentum and energy in the body that started with a fight and then continued on in sexual energy, causing euphoric and heightened sexual experience. Such activated state is always higher than the baseline norm of sexual arousal. This is what makes the make-up sex feel so powerful. Indeed, make-up sex feels more intense because it is. Sexual satisfaction in a relationship has certain significant benefits like building trust and intimacy, helping heal old emotional and sexual injuries, helping you become an expert on your partner, helping you to learn about yourself, building self esteem, supporting good health, improving sleep, reducing anxiety and stress, decreasing physical pain, for example, migraines, leading to wanting more sex, promoting better cognitive function. What is the ideal frequency of sex in a relationship differs. One study found that greater frequency is related to greater sexual satisfaction in both men and women. But there is no magic number that works for everyone. The optimal frequency is usually arranged between each person's libido because libidos are rarely equally matched. Like all things in relationship, sexual frequency need to be needs to feel fair to both parties. There is no right and wrong amount of sex that couples should be having in their relationships. However, if one of you feels frequency is a concern in your relationship, then you should make time to discuss what the expectations are or barriers to meeting each other's needs in this area. Differences in libido plays significant role in sexual fulfillment. If one partner seems to have no desire for sex, explore what causes this low sex drive in the partner. Before talking to your wife or husband about low sex drive, understand that men generally tend to have higher sex drives, and at least a third of women across reproductive ages experience low sexual and impaired arousal. Sexual behavior also tends to be more complex in women, and sexless marriages or dead bedrooms are not uncommon. Various potential causes for low sex drive in women includes health issues or chronic illness. There are many health issues, for instance, of chronic illness that would result in or contribute to low sex drive in women, including chronic fatigue syndrome, diabetes, hypertension, heart disease, cancer, multiple sclerosis, that is known as MS, endometriosis, obesity, spinal cord injury, and physical disabilities. A hormonal imbalance, for example, estrogen, progesterone, and testosterone, can result a lower sex drive in women. It is also relevant that loss of libido is common in women who have total hysterectomies. This is due in part to the decline in sex hormones being reproduced. Women with depression and women with anxiety may experience a loss of interest in sex, as can women who have history of sexual trauma or relationship PTSD, that refers to post-traumatic relationship syndrome, PTRS, is a form of traumatic stress caused by abusive or unhealthy relationships. Relationship trauma can cause lasting damage to self-esteem and make it difficult to form close, healthy relationships with others. Fortunately, many natural methods of treating anxiety and depressions, like exercise, proper sleep, and mindfulness, can also help increase libido. Medications, specifically antidepressants, can cause low libido and impaired arousal or orgasm. These drugs are fairly common, so it is important that you and your partner talk to a doctor about the potential ways that antidepressants are affecting how you feel. Emotional distance and resentment in marriages are associated with diminished libido and sexual satisfaction. If you and your partner are dealing with a lack of communication in your relationships or underlying resentment, consider seeing a couple therapist. The sooner you get professional guidance, the better. Sexual dysfunctions, which might include FSAD, female sexual arousal disorder, that is FSAD, female sexual arousal disorder, now called female sexual interest arousal disorder, FSIAD, is characterized by a lack of motivation to engage in sexual activity and absent or significantly reduced sexual thoughts and fantasies. Studies show that over 40% of all females will experience some form of sexual dysfunction over their lifetime. Female sexual disorder can apply to people assigned female at birth or individuals who are taking estrogen therapy and recognized as females, non-binary, or other genders. Sexual dysfunction, including impaired orgasm, vulvodynia, referring to chronic pelvic pain. It can be due to many things, including underlying disease and normal and hormonal balance or issues with mental health. Other factors include stress, drug use, alcohol consumption, tobacco use, and more. Chronic stress and fatigue can lessen the body's natural reproductive urge. If your partner is stressed, consider ways of helping them unwind. Mindfulness exercises and meditation can be a great tool, as well as guided imagery and progressive muscle relaxation. This could present significant challenges to the relationship. Each partner should take a non judgmental, sympathetic stance towards the partner's natural libido level and negotiate from there. Work on talking openly about libido levels and any feelings of rejection or frustration, specifically if you feel you are headed towards a sexless marriage or relationship. While many studies show that frequency of sex correlates with sexual satisfaction, it does not always tell the whole story. A satisfying sex life and a warm interpersonal climate seems to matter more than greater frequency of intercourse. If both parties feel that sexual encounters themselves are satisfying and that there is a high degree of emotional intimacy, then frequency becomes secondary, albeit often not entirely insignificant. Researchers tend to show that cisgendered men think about sex more frequently than women. Research on this topic hasn't fully caught up with diversity and inclusion efforts. So while gay men, lesbian women, and cisgendered heterosexual couples have all been surveyed, transgender and non binary people are conspicuously absent from this research. One national survey found that over 50% of men reported thinking about sex daily, whereas only 20% of women reported thinking about sex that often. Another study on desire and gender replicated those feelings, those findings in their study. 51% of men, 91% of men, but only 52% of women experience sexual desire several times a week or more. In other studies on daily sexual thoughts, 20 somethings were asked to monitor their sexual feelings for 1 week. Researchers found that men had more than twice as many sexual urges as was compared to the women. These results loosely held for people who identified as being same sex attracted, as well as those who were married or cohabitating. Still, cisgendered women's libido is complex. Some literature say that many women may not generate their own sexual fantasy, images, or impulses so much as to choose to respond to those brought by their partners. Many women resonate with the idea of two different types of sex drives: instigative and receptive. Some women seems to have much more of a receptive versus initiative drive. Enough for now.